Careblazer, today we are talking about a sensitive but important topic, and that is nursing home care, memory care, assisted living type care, basically any level of care beyond what you're providing in the home. Before I dive into this video, I want to just be very clear. Every single caregiving situation is different. And while some people make the promise to care for their loved one at home until their last breath, that is a beautiful thing. Other people may have that desire and intention as well, but due to things outside of their control and other life circumstances, they don't have that ability. So please, here in this Careblazer world, we are loving and caring and compassionate to one another, and we do not judge one another based on decisions they are making. Every situation is different. So I know that some people are going to be very strongly against some sort of other level of care, and other people are going to feel very guilty that they have made that decision for other level of care. But I am here to tell you, dementia caregiving is not easy. It's not the same for everybody. And whether you are caring for your loved one at home or whether you are caring for your loved one and visiting them in another facility, it's all okay. You are all still Careblazers, and it doesn't mean anything horrible about who you are. So please be kind and loving in the comments. That being said, in today's video, I am talking about 8 signs that somebody with dementia might be ready, or the caregiver might want to think about another level of care. Now, in all honesty, in the past, I would call this a higher level of care. Coming from the healthcare world, that's what we called it, a higher level of care, because they need more care. However, being in the Careblazer world, talking to caregivers day in and day out for the last 14, 15 years, I realized that that kind of sounds negative. A higher level of care almost gives the connotation that it's a better level of care, and a lot of Careblazers have a hard time with that. And so I want to be very clear that this is just a different level of care, a level of care outside of the home. It doesn't mean it's better. Sometimes it's better, sometimes it's not. Okay, here we go. Sign 1, that somebody might be ready for memory care or another level of care outside of the home. This is probably one of the biggest signs, and that is going to be safety concerns. When somebody with dementia starts exhibiting behaviors like frequent wandering, getting lost, even in familiar places, leaving doors unlocked or open, letting strangers into the home, especially if they're living alone, not knowing how to respond to emergency situations, like not knowing to call 911, not even recognizing or realizing what is an emergency, forgetting to turn off appliances like a stove. All of these are safety concerns and should start to raise a little bit of a question about whether this person is able to either 1, continue to live alone, or 2, continue to receive care in the home. Because when these safety concerns are shown, that's basically we're getting to 24/7 supervision. And I don't know a single human being who has the ability to provide 24/7 supervision. We often need a team. Another very common reason that family members start to explore different level of care often is when the person starts to have incontinence issues. They're no longer able to recognize the need to use the bathroom. So they're starting to have accidents requiring a lot of cleanup and time on the family member's part. Yes, this can be done in the home, but it is a lot of work, and oftentimes this is one of those determining factors that pushes a family member over the edge to realize I can't keep doing this on my own, and to make the decision to choose a different level of care. Number 3, this is a hard one, because even though it should allow the caregiver to start thinking about a different level of care, unfortunately, a lot of times a care facility may not accept the person because of the sign. So it's kind of a catch-22. The family members realize they need a different level of care, but the care homes and memory care facilities are like, oh, that's too much, we can't handle it. And so this is really about aggressive behavior. When somebody with dementia shows physical aggression towards family members or caregivers, or maybe has extreme suspicion and paranoia where they're very much confrontational to family members, accusatory to family members, this is a sign that family members might want to start thinking about a different level of care, but recognize it might be difficult for the care facility to accept. And this might require very close teamwork with mental health professionals, particularly a geriatric psychiatrist, to really think about medication options, but also a geropsychologist to talk about what can we do that doesn't involve medications? How can we adjust our behavior and things like that? But aggressive behavior, that's a common one as well. Number 4 is about declining physical health, where the person with dementia is requiring so much additional help and assistance to follow recommended treatment plans that it gets to be too much for the family member. For instance, perhaps the person with dementia is having increased falls, an increased fall risk, and it's really hard for the family member to watch 24/7 to make sure they don't fall. Increased mobility problems where the person's having significant difficulty moving around, even with the assistance of a cane or a walker or a wheelchair. So there's a lot of physical demand on the family member, and even things like the person becoming increasingly frail. Number 5 is going to be increasing difficulty with daily tasks. That can kind of go along with this declining physical health, but it's where the person is having significant difficulty or may no longer be able to do the daily tasks that they have to do, like dressing, bathing, grooming, toileting. These are absolutely things people can do in the home, but it becomes increasingly more difficult, especially if maybe all of the care is only on one person, or that one person still has a job and is still working, or even that main caregiver might have physical problems of their own and is having a hard time doing the physical demands of the caregiving tasks. Number 6, this is a really big one. This is going to be all about caregiver burnout. And I want to just say right here, like, ultimately, how do you decide when somebody is ready for memory care or another type of care? It's really when the family member decides. It's really when that main caregiver decides, I not even can't do it anymore, but this is not in my best interest or my loved one's best interest for me to keep doing it, because I am increasingly burned out and having a hard time managing my own life, not only my loved one's life. The caregiver might be struggling with their own depression, their own anxiety. They might be neglecting their own health to the point where their health is suffering. There might be a lot of strain in the family. Like, for instance, if the spouse is caring for a parent with dementia, and so the spouses are having a hard time, or they might be having a hard time raising kids. So many different reasons, but caregiver burnout is real. And this doesn't mean that you have failed. And absolutely, when we're thinking about a different level of care, you cannot just think about the person with dementia. You have to think about yourself as well, because you are the one providing all of this care. And if you are not in the state or ability to be able to provide that care, well, then now this is where we get to explore what other options might be available. And this is also a place for me to insert, because I know I'll get some comments about this as well. There's so much in between caring for a loved one at home and deciding to have your loved one go into a memory care facility. There's lots of room in between. There's help in the home, there's respite care, there's assisted living, there's adult daycare programs. There's so many things in between, but this video in particular is about signs you might want to start thinking your loved one could possibly go to a different level of care. Doesn't mean it's absolutely necessary, but just a possibility. 7, let's talk about social isolation. This one doesn't get talked about a lot for people with dementia. For the most part, when we think about deciding on a different level of care, we often think the person with dementia just won't like it, won't want to go. However, there are some people with dementia who are very social, who want to engage, who want to do activities, and having a place where there are structured activities, other people to communicate with, that could be a reason to consider that different level of care as well, because it would give them more opportunity for social engagement and activities, especially if the caregiving situation at home doesn't allow for a lot of outings or for the caregiver to have the time for a lot of activities. So that's a possibility. 8th and final sign, somebody might be ready or at the point of being ready for a different level of care. It's kind of a catch-all, and it's basically if somebody needs some sort of specialized care that's really just too difficult to give in the home, whether it's a complicated medication regimen, whether it's some sort of complicated medical equipment that's difficult to acquire in the home, whether it's needing expert supervision over symptoms 24/7, those kinds of things where it's just really difficult for one or just two to people to provide that level of care. Now, ultimately, whenever somebody's thinking about going into a different level of care, we have our signs that would prompt us to start looking, but also that care facility is going to have their criteria. So just because you're thinking maybe my loved one is ready for this different type of level of care, it doesn't necessarily mean that your loved one is, and that's where discussion with your healthcare team is going to be important, but also the care facility that you're looking at, they'll have their own criteria about who is a good fit and who isn't. There's different types of care facilities, from assisted living facilities, and even that word can mean so many different things. It could be a small group home, it could be a large multi-floor facility. And so all of them are going to be different in who they accept, the criteria they accept, what they're able to handle, the types of healthcare professionals on staff. And so that's really where your exploration and research is going to come in handy. But ultimately, these facilities exist for a reason. Sometimes care goes beyond what we are able to manage, and sometimes care goes beyond what we are willing or want to manage. And all of that is okay. I'm sending you so much love. If you have a sign or a symptom that prompted you to decide to place your loved one in a different care facility, I'd love to know it below, especially if I didn't say it. What were some other signs or determining factors that helped you decide whether to put your loved one in a care facility or keep them at home? Share that in the comments below. Help another Careblazer out. And just remember, Careblazer, we do have a comprehensive program called the Care Collective, where we come together every week for support groups, expert Q&As, conversations with me, more personalized support and guidance. You can learn all about that in the description below this video. I'm sending you so much love. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.